we welcome Dr. Uma Hari, OBGYN physician at Southcoast Health. We're going to find out where Dr. Hari earned her medical degree from, and we're going to find out a little bit about Dr. Hari as we welcome her to the program this morning. Nice to have you with us.
Thank you for having me.
Absolutely. May I ask that you get very close to that microphone and give us a little sense of where did you get your training? No, I want to start here. Why did you ever want to become a physician?
Well, my father was a physician, so it was exposed to me from an early age. So it's what I was used to, and I was always very interested in it. So from probably 6 or 7, I said I wanted to become a physician, and I became a physician.
There you go.
Yeah.
From a young child. That's wonderful. I'm so happy to hear that our parents influence us in such a positive way like that. Dr. Hari, tell us a little bit about your background. Where did you receive your degrees from? A little about yourself.
So I did my undergraduate studies in chemistry at the Pennsylvania State University, my medical school at the Philadelphia College of Osteopathic Medicine, and I did my Obstetrics and Gynecology residency at the University of Miami-Jackson Memorial Hospital.
Wow. And you are board certified in
I
Obstetrics and Gynecology and a member of the American College of Obstetrics and Gynecology.
Yeah.
And folks, we are going to talk about something very, very important this month, as this September is a very important month for ovarian cancer awareness. Tell us a little bit about why this is so important for women to be aware, and give us a little sense of that importance, Doctor.
Okay. So ovarian cancer affects about 1 in 70 women get diagnosed with the disease. The issue with ovarian cancer is that it usually is diagnosed in the later stages. So kind of being aware of actually the disease, the early symptoms can really help your survival rate.
What are some of the signs or symptoms you want to do? You know, as you say, we catch it early.
Yeah.
How?
So really, their symptoms are pretty vague. So it's like increase in abdominal size or bloating, pelvic or abdominal pain, difficulty eating or feeling full quickly, urinary complaints such as urgency or frequency. Other commonly reported symptoms include fatigue, indigestion, constipation, and back pain. And most women with these symptoms do not have ovarian cancer, but if you recognize that these symptoms are new onset, they're very frequent, they happen daily for a few weeks over a month, you really should contact your physician, especially your gynecologist.
We're with Dr. Uma Hari, OBGYN physician at Southcoast Health, as we talk about especially a topic that's important to our women in our listening audience, September being Ovarian Cancer Awareness Month. And what should a woman do if she is worried about this?
She should meet with her doctor, and we recommend as a gynecologist annual GYN exams, which are very important to get a physical exam, but also just to discuss your risk factors for different types of disease states, including ovarian cancer.
Yes, of course. As we take a look at this very important month, you mentioned at the very beginning how many women are affected by this?
Yes. So 1 in 70 women, about 21,000, 22,000 cases are diagnosed each year. 15,000 women die of it each year. So it's the 5th most common cancer in women, but it is the 2nd most deadliest GYN cancer.
Mm-hmm. Are there any ways to prevent things like this?
So yes, using birth control, like oral contraception is a protective factor. Pregnancy, removal of ovaries and fallopian tubes in high-risk women during different types of GYN surgeries. Getting your tubes tied or tubal ligation is a protective factor. A hysterectomy can be a protective factor, and breastfeeding is also a protective factor.
Interesting. And if a listener wants to get in touch with you or perhaps another doctor in your practice, where do they call? How do they get a hold of you?
So you can call Southcoast Physicians Group at 508-973-2208. We are located at 543 North Street in New Bedford.
Very, very good. And once again, this is Ovarian Cancer Awareness Month. And with us, Dr. Uma Hari, OBGYN physician at Southcoast Health. I'm sure you're enjoying this area.
I am.
And we're so lucky to have a doctor of your caliber here. And for folks wanting to get a hold of you, just gave out this information, by all means, what didn't I ask you? That's very important to share with our listening audience, Doctor.
Just maybe some risk factors for ovarian cancer. 70% of ovarian cancer occurs after the age of 50. The median age of diagnosis is 63. Women with certain inherited mutations such as BRCA1 and BRCA2 have about a 45% lifetime risk of developing ovarian cancer. Also, there are some syndromes that are associated with colorectal cancer that put you at increased risk for ovarian cancer. A family history, a woman with one first-degree relative, a mother or a sister, have about a 3 to 5% lifetime risk of developing the disease. Infertility, having no children, early age of having your menses or a late menopause, and living in a westernized society actually increases your risk. So once again, I think it's just very important to know your family history and discuss this with your doctor and see if you qualify for any genetic testing or genetic counseling appointment.
Now, as we age, does the possibility get bigger?
It does.
Okay. So these are, obviously then, this is a message for all women.
Yes.
Young, middle-aged, and old.
Yes.
And is there anything else that you'd like to share with us?
No, I think
Okay,
I've covered most of it.
And women who appear to be at high risk for ovarian cancer should undergo counseling. And once again, your information is, how do they get a hold of you?
So Southcoast Physicians Group, Obstetrics and Gynecology. We're located at 543 North Street in New Bedford, and our phone number is 508-973-2208.
Very, very good. Anything else?
No, thank you for having me.
Oh, Dr. Uma Hari, OBGYN physician, you're wonderful here at Southcoast Health. I want to thank you. I want to thank Peter Coeno, the Public Information Officer and New Media Specialist, for helping set up this wonderful segment, this vignette that is a regular on WBSM. And we thank you folks also. If you have any questions, you can always let us know at WBSM.com. We will be back in just a moment. There's a lot of weather going on the South Coast, lightning, thunder, and we will keep you abreast of that when we return. Don't go away.